Hello, I'm Dr. Robert Harrison. If you're over the age of 60 and you've noticed that everyday tasks feel harder than they used to, if getting out of a chair takes more effort, if climbing stairs leaves your legs shaky, or if you've quietly stopped doing things you once loved because your body no longer feels strong or reliable, then this message is for you. Today, I want to talk to you about one simple daily habit that research shows can help seniors rebuild muscle strength, restore confidence, and protect independence. This is not about extreme workouts, expensive equipment, or pushing your body beyond its limits. It's about understanding how your muscles work, how aging truly affects strength, and how a small, consistent habit can make a powerful difference at any age. Many older adults believe that muscle loss is an unavoidable part of aging. They think weakness is something they must simply accept. But that belief is not only discouraging, it's incorrect. While it is true that we naturally lose muscle mass as we age, especially after the age of 50, the body does not lose its ability to rebuild strength. Muscles respond to use at 80 in much the same way they do at 40. They adapt, they repair, and they grow stronger when given the right signal. The problem is not age. The problem is that most seniors stop giving their muscles that signal. I see this every day in my practice. People tell me they've become careful, they sit more, they move less, they avoid lifting, pushing, or standing too long because they're afraid of pain, injury, or falling. Over time, muscles that are not challenged begin to shrink and weaken. That weakness then increases the risk of falls, joint pain, poor balance, and loss of independence. It becomes a cycle that feeds itself. But the good news is that cycles can be reversed. The one daily habit that helps seniors rebuild muscle strength is short, consistent, progressive resistance exercise. That phrase may sound technical, but the concept is simple. Resistance exercise means asking your muscles to work against something, whether that's your own body weight, a resistance band, or a light dumbbell. Progressive means that over time, as your muscles adapt, the challenge gradually increases. And daily does not mean long, exhausting workouts. It means brief, manageable sessions done consistently. Many people ask me why daily matters. Isn't exercising a few times a week enough? For younger adults, perhaps. But for seniors, frequent small doses of muscle activation are incredibly powerful. Muscles respond to repeated signals. Each time you challenge them, your body initiates a repair process. When those signals come regularly, the body maintains and strengthens muscle tissue more effectively. Daily short sessions are also easier to stick with. They reduce soreness, lower injury risk, and help exercise become a habit rather than a chore. It's important to understand that rebuilding muscle does not require a gym. It does not require heavy weights. It does not require pushing through pain. It requires intention, consistency, and patience. Even simple movements, when done correctly and regularly, can produce real changes in strength and function. Let me give you an example. One of my patients, a woman in her early 70s, told me she avoided visiting her daughter because she was embarrassed by how hard it was for her to get up from the couch. She felt weak and old, and she assumed there was nothing she could do about it. We started with one simple habit, standing up from a chair and sitting back down, slowly and with control, a few times each day. That was it. No gym, no equipment. Within weeks, she noticed she was standing more easily. Within months, she was walking more confidently. Her strength returned not because she was young, but because her muscles were finally being used again. This is how the body works. Muscles are remarkably adaptable. When you ask them to do more, they respond by becoming stronger. When you don't, they weaken. Age does not change this fundamental rule. Now let's talk about what progressive resistance actually looks like in daily life. It starts with choosing movements that target the muscles you rely on most. These include the muscles in your legs, hips, back, chest, arms, and core. These muscles help you stand, walk, lift, reach, and maintain balance. Exercises such as standing up from a chair, pushing against a wall, pulling a resistance band, or lifting light weights all provide resistance. At first, the resistance should feel manageable but slightly challenging. You should feel your muscles working, especially near the end of each movement, but you should still be able to maintain good form and breathe comfortably. Progression is where many people go wrong. Some think progression means pushing harder every day. That's not true. Progression is gradual. It might mean adding 1 or 2 repetitions. It might mean switching to a slightly stronger resistance band. It might mean performing the same movement with better control or less reliance on support. The goal is not speed or exhaustion. The goal is steady improvement. When you perform resistance exercise, tiny microscopic changes occur in the muscle fibers. Your body responds by repairing those fibers and reinforcing them. This repair process requires rest and nutrition, but it does not require long recovery periods when the exercise is appropriate for your level. That's why daily short sessions work so well for seniors. They stimulate muscle repair without overwhelming the body. A typical daily session can be as short as 15 to 20 minutes. That includes a brief warm-up, a few simple strength movements, and a short cool-down. The warm-up might be marching in place, gently swinging your arms, or slowly bending and straightening your joints. The strength movements should focus on large muscle groups. Standing up from a chair strengthens the legs and hips. Pushing against a wall strengthens the chest and arms. Pulling a band strengthens the back and shoulders. Heel raises strengthen the calves and improve balance. These are practical movements that translate directly into better daily function. As you perform these movements, pay attention to how your body feels. Muscle effort is normal. Mild soreness is normal, especially when you are starting. Sharp pain, joint pain, or dizziness are not. If something hurts, stop and adjust. Use support when needed. Sit when you need to. Progress is not about perfection. It's about consistency. One of the most important benefits of daily resistance exercise for seniors is improved balance and fall prevention. Strong muscles help stabilize joints. They allow you to correct your posture when you stumble. They give you the confidence to move without fear. Falls are one of the leading causes of injury and loss of independence in older adults, and muscle weakness is a major risk factor. Strength training addresses this risk directly. Another important benefit is metabolic health. Muscle tissue helps regulate blood sugar, supports healthy weight, and contributes to overall energy levels. As muscle mass increases, many seniors notice improved endurance and less fatigue during daily activities. They feel more capable. They feel more like themselves again. There is also a psychological benefit that should not be underestimated. Rebuilding strength restores confidence. When you realize that your body can improve, that you are not stuck in decline, it changes how you approach aging. It replaces fear with agency. That sense of control is deeply empowering. I want to be very clear about safety. If you have chronic health conditions such as heart disease, uncontrolled high blood pressure, severe osteoporosis, or if you have recently had surgery, you should speak with your healthcare provider before starting a new exercise routine. That said, for the vast majority of seniors, properly guided resistance exercise is not only safe, it is strongly recommended by medical and aging organizations worldwide. You do not need to push through pain. You do not need to compare yourself to anyone else. You do not need to do everything at once. The only thing you need is the willingness to begin. The biggest mistake I see seniors make is waiting until they feel strong enough to start. Strength comes from starting, not from waiting. Even very weak muscles can become stronger when they are used gently and consistently. The body responds to what you ask of it. If you ask for nothing, you get weakness. If you ask for a little more each day, you get strength. In Part 2, I will walk you through a simple week-by-week plan to help you build this habit safely and effectively. I'll talk about how to adapt exercises if you have arthritis or balance problems, how nutrition supports muscle repair, and how to measure your progress in ways that truly matter. But for now, I want you to remember this. Aging does not take your ability to rebuild strength. Inactivity does. If you take away one message from today, let it be this. A short daily habit of gentle, progressive resistance exercise can help you rebuild muscle strength, protect your independence, and improve your quality of life. Not someday, not when you feel ready, but starting now, exactly where you are. In Part 1, we talked about the single daily habit that helps seniors rebuild muscle strength: short, consistent, progressive resistance exercise. Now in part 2, I want to show you exactly how to turn that habit into a safe, realistic routine you can follow week after week. We'll talk about how to start if you feel weak, how to progress without injury, how food supports muscle repair, how to adapt exercises if you have joint pain or balance concerns, and how to know whether what you're doing is actually working. My goal is simple: to give you a clear path forward without confusion, without fear, and without unrealistic expectations. Let's begin with what starting actually looks like. Many seniors delay exercise because they believe they need to feel ready first. They wait until their energy improves, until pain goes away, or until they feel stronger. But readiness doesn't come before action. It comes after. The strongest predictor of success is not how fit you are today, but whether you start with something small and repeat it consistently. That's why the daily habit we're discussing is intentionally short. 15 to 20 minutes is enough. If even that feels like too much at first, 10 minutes is fine. The body responds to regular signals, not heroic effort. During the first 2 weeks, your focus should be learning movements and establishing the routine, not pushing intensity. Your muscles, joints, and nervous system are waking up after a period of relative rest. This is a time to move slowly, breathe steadily, and pay attention to how your body responds. You might notice mild muscle soreness, especially in the thighs or arms. This is normal and usually fades within a day or two. What you should not feel is sharp pain, joint pain that worsens with movement, or lingering exhaustion. If you do, the solution is not to stop entirely, but to reduce the difficulty and continue gently. As the weeks go on, progression becomes important. This is where muscle rebuilding truly happens. Progression does not mean adding more exercises or doubling your workout time. It means gradually increasing the challenge of what you're already doing. That might be standing up from a chair without using your hands when before you needed them. It might be adding a few more repetitions. It might be switching to a slightly stronger resistance band. These changes may seem small, but to your muscles, they are powerful signals to adapt. One helpful way to think about progression is to notice when an exercise starts to feel easier. When you can complete your repetitions while still maintaining good form and breathing comfortably, your body is telling you it has adapted. That is your cue to make a small change. The change should feel noticeable but manageable. You should feel your muscles working by the last few repetitions, but you should never feel out of control. Strength grows in the space between comfort and strain, not in pain. Now let's talk about frequency. Many seniors worry that daily exercise will be too much. In reality, when sessions are short and appropriate, daily movement is often better tolerated than occasional long workouts. Daily resistance exercise keeps muscles active, improves circulation, and reinforces the habit loop. It also prevents the stiffness that can occur when there are long gaps between sessions. That said, your body does need rest. Rest does not mean doing nothing. It means alternating intensity. Some days will feel stronger than others. On lower energy days, you can reduce repetitions, slow your pace, or focus more on gentle movement and balance. Listening to your body is part of the process. Nutrition plays an important supporting role in rebuilding muscle, and this is an area where many seniors unintentionally fall short. As we age, our appetite often decreases, and we may eat smaller meals with less protein. Protein is essential for muscle repair. After you challenge your muscles, your body needs amino acids to rebuild them. This does not require supplements or special products. It requires being intentional about including protein at meals. Aim to include a source of protein with each main meal. This might be eggs, yogurt, fish, poultry, beans, lentils, tofu, or dairy products. Spreading protein intake across the day is more effective than consuming it all at once. Many seniors benefit from increasing protein at breakfast, which is often the lowest protein meal of the day. If you exercise in the morning, pairing your session with a protein-rich breakfast can support muscle repair. If you exercise later in the day, ensure your next meal contains adequate protein. These small adjustments can make a meaningful difference over time. Hydration is also important. Muscles function best when the body is well hydrated. Even mild dehydration can contribute to fatigue and muscle cramps. Make it a habit to drink water throughout the day, especially around your exercise sessions. This is particularly important if you take medications that affect fluid balance. Now let's address some common concerns. One of the most frequent questions I hear is, what if I have arthritis? The answer is that resistance exercise is often beneficial for arthritis when done correctly. Strengthening the muscles around joints reduces joint stress and improves stability. The key is to use controlled movements, avoid locking joints, and stay within a comfortable range of motion. Seated exercises, resistance bands, and water-based movements can be excellent options. If a particular movement consistently aggravates a joint, modify or replace it rather than pushing through pain. Another common concern is balance. If you feel unsteady, always prioritize safety. Use a chair, wall, or countertop for support. Many strength exercises can be done seated or with one hand holding a stable surface. As your strength improves, your balance often improves as well because strong muscles help stabilize your body. Balance training can be gently incorporated through exercises such as marching in place or shifting weight from one foot to the other while holding support. Fear of injury is another barrier that keeps many seniors from starting. It's important to understand that inactivity carries its own risks. Muscle weakness increases the likelihood of falls, fractures, and loss of independence. When resistance exercise is performed with proper form and gradual progression, the risk of injury is low. In fact, strength training is one of the most effective ways to reduce injury risk in older adults by improving stability and resilience. Let's talk about motivation, because even the best plan fails if it's not followed. Motivation is not something you wait for, it's something you build through action. One of the most effective strategies is to tie your exercise habit to something you already do every day. That might be after brushing your teeth, after morning coffee, or before watching the evening news. When exercise becomes part of a routine rather than a decision, it requires less mental effort. Tracking progress is another powerful motivator. Progress does not always show up on a scale or in the mirror, especially at first. Instead, pay attention to functional improvements. Are you standing up more easily? Are you walking longer distances without stopping? Are you carrying groceries with more confidence? These are meaningful signs that your muscles are getting stronger. You can also track simple measures, such as how many times you can stand up from a chair in 30 seconds. Repeat the test every few weeks and notice the changes. It's also important to be patient. Muscle rebuilding takes time. Most seniors begin to notice improvements in strength and function within 4 to 8 weeks, but the greatest benefits come from long-term consistency. Think of this habit as an investment in your future self. Each session is a small deposit. Over months and years, those deposits add up to greater independence, better mobility, and a higher quality of life. There will be days when you don't feel like exercising. That's normal. On those days, remind yourself that doing something is better than doing nothing. Even 5 minutes of movement maintains the habit and keeps your muscles engaged. Consistency matters more than perfection. As we come to the end of this discussion, I want to leave you with an important perspective. Aging does not mean giving up strength, it means training smarter. Your body is not fragile, it is adaptable. It responds to what you ask of it. When you ask it to rest constantly, it weakens. When you ask it to move, to resist, to adapt, it responds with strength. You do not need to reclaim the body you had at 30. You need to build the strongest, most capable body you can have right now. That is entirely possible. The daily habit we've discussed is not a shortcut or a trend. It is a proven, practical approach supported by decades of research and clinical experience. If you take one step today, let it be this. Choose one simple strength movement and do it with intention. Tomorrow, do it again. Over time, add a little more. Let strength become part of your daily life, just like eating or sleeping. Your future self will thank you for it. I'm Dr. Robert Harrison, and my mission is to help you age with strength, confidence, and independence. If this message helped you, share it with someone who needs to hear it. And remember, it's never too late to begin rebuilding muscle strength, starting today.